One of the factors which came out from our research from Cambridge University showed that 68% of our patients were either obese or overweight, which is a pretty bad statistic really. I know it's very difficult for patients and they often put on weight during chemotherapy, etc. But nevertheless, that's not really addressed in a frontline oncology community like ourselves. So first of all, we need to address obesity, either through exercise or dietary measures. We also know that the level of sort of fruit and veg or healthy foods which contain polyphenols is lacking. You know, the British diet is pretty low in what we call polyphenols. So, you know, most of my patients, for example, would not take, you know, green tea or herbs and spices. They have a reasonable vegetable intake, but it's not anywhere like the level you see in the Far East or India, which have very high level of polyphenol intake. So one of the trials we did last year, which we presented at ASCO, was looking at whether we can boost an individual's diet with whole food supplements, which are very rich in these anti-cancer polyphenols. And we're very pleased at that stage we managed to, through a double-blind randomised trial, show that you can put these foods into a pill and you can get a therapeutic effect. In that trial it was actually looking at PSA levels and changes of tumour size on MRI scan. So that's something we should be sort of working more on, trying to find foods and find supplements which are able to boost deficiencies in the UK diet. At the street level, I mean, with only 11% of patients exercising, I think the message is you just need to do some exercise. Obviously, there are a few individuals who would be very keen on learning about their anaerobic threshold and, you know, what quality of exercise to do, whether they should do too much. But on a practical level, the message is we just need to get to people off the sofa and walking briskly and joining groups. In terms of diet, of course, there is a lot of scepticism about the latest dietary scares. The WHO issued a statement that processed meat is harmful. Of course, that's been well known for years, and there's lots of data to show that certainly bowel, prostate and pancreas cancers have an increased incidence in people who eat a lot of processed food. So what the WHO have done is just issued a statement to make it sort of more official. And that does come to a shock to many people. So it's good that they issued the statement. But they get very sort of suspicious of the powers that be, the patients. You know, they're trying to destroy their enjoyment in life. And what I always say in my book and in other local guidelines we've written is it's actually not just about the carcinogen intake. So if you eat a cheap sausage which you fried to a crisp on a frying pan, covered it with aromatic hydrocarbons which are pretty carcinogenic, yeah, you can still do that if you really want to, but if you then have the natural antidote to carcinogens, which, as I just said, are the polyphenols, which are nature's gift to us really. They make food look nice, taste nice and smell nice, and they actually have anti-cancer properties. So I always say to the patient, look, you don't need to convert yourself into jogging every day and eating tofu for breakfast. You can still have something you enjoy, but just mix it with the natural antidote. So make sure you've got some pepper, maybe some spinach with your fry up. Or if they're not willing to do that, take a supplement which is rich in polyphenols, which we know has anti-cancer properties. So it's all about a balance. But most patients, I'm afraid, don't have the balance. They will eat, a burnt processed sausage, bacon, baked beans full of sugar, and for lunch they'll have more meat with white bread. So the balance is very much in favour of having lots and lots of carcinogens and none of the antidotes. So I think the message is we need to get them to balance so they have much more of the antidotes.